Hey Lifesavers, and welcome back to my channel. My name is Nurse Kelly Tyrrell, and in today's video we are going to wrap up our pediatric mini-series by answering some NCLEX simulated questions which will test our retention of the information over the last 2 weeks. But before we jump into it, make sure you subscribe to my channel, like, comment, and share this video with a friend, and make sure you click on that bell icon to turn on notifications so you don't miss out on my upcoming content. If you need to brush up on your pediatric nursing skills, including developmental milestones and cardiac defects, then I suggest you keep watching. All right, let's go ahead and jump right into our first question involving growth and developmental milestones. So the question reads, which developmental milestones will the nurse expect to assess in the 10-month-old infant? And we're going to select all that apply. The options are holding the head up erect, self-feeding, having good bowel and bladder control, sitting on a firm surface without support, walking while holding onto furniture, or walking alone. Okay, so I first want to preface this answer by saying that every child is different with their milestones. Some are more advanced than others, and it's important when you are answering these questions that you are remembering the expected milestones that are laid out for the NCLEX and not thinking about your own child's development and answering it that way, because chances are your child probably developed a little earlier or a little later than the milestones that we are about to talk about. So you don't want to let real-world experiences cloud the textbook knowledge that is tested on the NCLEX. So that being said, let's look at option 1, holding the head erect. So if you remember from my previous lecture, I talked about how infants should be able to hold up their own head by 4 months old. So this option we know is going to be a correct option. Option 2, self-feeding. So I had talked about infants developing 3 different grasps within the first 10 months, which are the palmar grasp, the raking grasp, and the pincher grasp. So the pincher grasp will have to be mastered before the infant can start to self-feed, because if not, they're going to try to shove a huge handful of food in their mouth, which is a major choking hazard. So they start developing the pincher grasp around 10 months, which means it's going to take another month or 2 until the infant has mastered the grasp enough and developed those fine motor skills to hold a utensil to the point where they are ready to self-feed. So self-feeding with a utensil is a skill that typically develops around 12 months. So 10 months is a little too early, making this an incorrect answer. So moving on to option 3, having good bowel and bladder control. So potty training doesn't start until toddler age, which is after 1 year old, and most toddlers will have dryness during the day between 18 months and 3 years, and nighttime dryness from 2 to 5 years old. So this is also going to be an incorrect answer. Option 4, sitting on a firm surface without support. So unsupported sitting, if you remember from my lecture, typically occurs around the 7 to 9 month mark. So yes, this would definitely be an appropriate and an expected milestone. And the last 2 options, option 5, which is walking while holding onto furniture, and option 6 is walking alone. So at this age, infants are starting to become more and more mobile, but they are still too young to be fully independently mobile. So they develop something called cruising, where they walk along furniture, and it's a very classic milestone at the 10 to 12 month mark, making option 5 a correct answer and option 6 an incorrect answer. So our final correct answers here are going to be option 1, 4, and 5. All right, let's take a look at another growth and development question. So the question reads, when discussing death and dying with 10 and 11-year-old children, which guides will the nurse incorporate? Select all that apply. Option 1, logical explanations are not appropriate for this age. Option 2, the children will be curious about the physical aspects of death. Option 3, the children will know that death is inevitable and irreversible. Option 4, the children will be influenced by the attitudes of adults in their lives. Option 5, educating children about death and dying should not start before the age of 11. And option 6, telling children that death is the same as going to sleep is appropriate. Okay, so first you'll want to identify what age group we're talking about in the question. So children between the ages of 6 to 12 years of age are in the school age group. So if you remember from my growth and development lecture, I talked about how children in the preschool age group respond really well to logical explanations. They are starting to develop that emotional intelligence and want to learn about the world around them. So this emotional capacity is developed by the time children are in the school age group. So option 1 is not going to be the correct answer here. School age children are naturally curious about the physical aspects of death, and they may wonder what happens to the body. By 9 or 10, most children will know that death is universal or inevitable and irreversible. Their cognitive abilities are now advanced, and again, they are going to respond really well to logical explanations, and they should be encouraged to ask a lot of questions. Because adults influence children's attitudes towards death, they should be included in the family rituals surrounding death and be prepared to answer some uncomfortable questions. Educating children about death should begin in early childhood. Comparing death to sleep can be really frightening for children and can cause them to be fearful of falling asleep. So you should never ever compare death to sleep. So all of that being said, options 5 and 6 are not going to be the appropriate answers. So for this question, our correct answers are going to be options 2, 3, and 4. Okay, let's look at some pediatric cardiovascular questions. So the next question reads, the nurse suspects a neonate has a patent ductus arteriosus. Which assessment findings will the nurse expect this client to exhibit? And we're going to select all that apply. So is it poor feeding pattern, bounding heart rate of 150 beats per minute, acrocyanosis, icteric sclera, respiratory rate of 75 breaths per minute? Okay, so for this question, you want to refer back to my lecture on common pediatric heart defects, part 1, where I talked about the disease etiology of a PDA. I talked about how in utero babies have these secret passageways to shunt blood away from the lungs since they are not yet taking breaths. And within 15 hours of life, the PDA is supposed to close, which allows the unoxygenated blood to enter into the lungs through the pulmonary artery from that right ventricle, so it can be oxygenated. So if the PDA doesn't close, then there is going to be a really high level of unoxygenated blood circulating throughout the body. So you want to think about what symptoms will you see. I also talked about some common symptoms that all cardiac conditions had in common, and you want to make sure you're familiar with these common symptoms, so that way you can identify an early cardiac compromise in these pediatric patients. So some of those symptoms included failure to thrive or poor eating, because these babies are going to be working really hard when they're at rest, so they are going to have to work even harder when they try to eat. Also, if the heart is compromised, it's going to have to pump extra hard, which is going to create a really fast and bounding heart rate. You'll also see tachypnea or fast breathing, because the body is going to try to correct these low oxygen levels by trying to breathe faster, which will oxygenate more blood. So the correct answers for this question is going to be option 1, 2, and 5. Option 3, that acrocyanosis is caused by spasming of the small blood vessels within the skin, which causes a bluish color to the extremities. But you want to be careful not to confuse acrocyanosis with central cyanosis, where you have those bluish lips. A bluish color to the extremities of a newborn is actually completely normal after birth. And icteric sclera refers to yellowing of the eyes, which indicates jaundice and not cardiac compromise. So that is not going to be the correct option either. Okay, now let's look at our last question, which talks about a very important but very high risk cardiac medication that you'll definitely want to know in and out. So the question reads, a teenage client diagnosed with heart failure is taking digoxin. The client asks the nurse, what will this drug do for my heart? What is the best response by the nurse? Is it option 1, it will cause vasodilation and will help with chest pain? Option 2, it will decrease the workload of the heart. Option 3, it will help your body excrete sodium. Option 4, it will increase your resting heart rate. So it's very common that pediatric patients born with heart defects experience some type of heart failure, either left-sided or right-sided, depending on where that defect is located. So you'll want to be familiar with the different classes of medications used to treat heart failure, including ACE inhibitors, ARBs, diuretics, calcium channel blockers, nitrates, vasodilators, and cardiac glycosides, which is what digoxin is. So glycosides decrease the workload of the heart, which improves myocardial function and will help the heart pump more efficiently. And it does this by slowing down the heart rate, which allows the heart to more easily contract to move that blood through each chamber and out to the rest of the body. So this medication does not cause increased sodium excretion. That class of medication is actually in diuretics. And this medication doesn't cause vasodilation, so our correct answer here is option 2. If you want a sneak peek into next week's lecture, make sure that you tune in live with me. I go live on all of my social channels, including right here on YouTube, 9 p.m. Eastern Standard Time. So make sure you tune in if you want a sneak peek of my upcoming lectures next Wednesday at 9 p.m.
And that concludes the end of this lesson. I hope that you found this information extremely valuable and it made you just a little more confident as you prepare to take your NCLEX or your next nursing school exam. I just want to thank you all again so much, Lifesavers, for tuning in today. My name is Nurse Kelly Tyrrell, and I help nurses feel more confident, increase their test scores, and retain what they don't remember in nursing school. Speaking of, are you a nursing student or soon to be or ready to take your NCLEX? If so, have you joined my online student community yet? If not, then what are you waiting for? The UNursity community is a complete nursing resource hub all at your fingertips. Inside, you can expect to receive coaching, community, and content. You'll get daily coaching with your mobile mentor, me, Nurse Kelly Tyrrell. You'll also receive access to weekly educational videos that you can watch months before they even publish to YouTube. You'll also get exclusive printable digital downloads like worksheets, quizzes, flashcards, infographics, cheat sheets, skills checklists, and more. And if this video helped you in any way, be sure to give it a thumbs up. Also, don't forget to smash that subscribe button and click that notification bell so you don't miss out on my upcoming content. Also, if you can do me a favor and drop me a comment below, let me know where you're at with your nursing journey. I'd love to just say hi and connect with you. Also, make sure you click that share icon to spread the word and encourage a fellow aspiring nurse. And last but not least, when you are ready to take your NCLEX, be sure to check out my NCLEX and Chill review, where I review detailed test-taking strategies and cover every major topic that you can expect to find on the NCLEX. If you want to have that unfair advantage and pass your NCLEX on your very next attempt, be sure to click the link in the description box below. Not ready to end the study sesh yet? Well, you are in luck, because if you stick around, you can watch more of my videos coming at you in 3, 2, 1. Bye, Lifesavers.